My name is Mariette Chartier. I'm a senior research scientist at the Manitoba Centre for Health Policy at the University of Manitoba. The focus of our study was to look at the mental health of adult Manitobans and its impact on them. And also we wanted to look at children and adolescents with mental illness and follow them until they are adults to see how they are doing. So we found that mental illness among Manitoba adults is very common. We looked at a whole range of mental health problems, and what we found was that 28% of Manitoba adults were diagnosed with a mental illness over a 5-year period. This is the rate that we found of people who were diagnosed. We know that many people with mental health problems do not get a diagnosis. So if we were to try to estimate the amount of people suffering from mental illness, it would actually be higher than 28%. Our study has shown that there is a high prevalence of mental illness among adults, and we were interested in knowing, well, where are those individuals? And so we looked at different groups: people receiving income assistance, people living in social housing, people in personal care homes, people in the justice system. And what we found was that those groups are actually at greater risk of mental illness. They had higher prevalence than the 28%. So what we learned from there is that it's important for our workforce to be skilled in their mental health knowledge so that they can address the needs of people with mental illness, because they're everywhere. I mean, when you think about it, 1 in 4 people have struggled over a 5-year period, have struggled enough to go see a physician and say, I'm depressed, or I'm anxious, or I'm having trouble with my relationships. And so that's a significant amount of people. So I think it would be important for all of society to be more knowledgeable about mental illness. We looked at a group of people who had a childhood mental illness and a group of people who didn't, and followed them into their early adulthood until they were 35 years old. And what we found was that people who had a mental illness during their childhood were more likely to get in trouble with the law, were more likely to receive social services, were more likely to attempt suicide or die by suicide. We also found that, unfortunately, 2/3 of them continued to have their mental illness in adulthood. So as a province, how do we support people living with mental illness? I think the first thing is the old saying that an ounce of prevention is worth a pound of cure. So there's more and more data that is telling us that if we could prevent mental illness in the first place, that would go a long way. We know that early childhood programs, a healthy school environment goes a long way in protecting children and adolescents. We know that for adults, employment opportunities or healthy neighborhoods are important. We also know that those living in lower socioeconomic areas are more at risk. So if we could find a way as a society to ensure that there's less disparity between the very rich and the very poor, that would be helpful. I think the big thing that we think about is how do we improve our mental health services. It's pretty well known that across Canada we are underspending when it comes to mental health services, and so we could better integrate mental health services into other government systems. We could address the barriers to care. We could improve services in remote areas of Manitoba. So those are some places where we could improve the mental health services. And finally, I think, I wouldn't be a researcher worth my salt if I didn't say that we should invest in research and evaluation. We've learned a lot through the decades about mental health and mental illness, but there's still a lot we need to learn about mental health promotion, about prevention, about early intervention, and about better treatments to meet the needs of people with mental illness.